Welcome. In today's video, we learn more about Stevens-Johnson syndrome, how to replace the medications, electrolyte imbalances, the use of steroids, and preventing secondary infections. And we're starting right now. I'm Matt Hamilton. I'm a trial lawyer. I represent victims. I'm joined today by Dr. K.K. Hamilton. She started as a laboratory scientist, studying the blood, hematology, bone marrow, and microbiology. She went on to achieve her doctorate. She worked at a number of largest hospitals in the United States. She had a postdoctoral fellowship treating patients, and she's gone on for medical information specializations, yes?
Mm-hmm.
Treating adverse events from medication. Welcome, doctor.
You're welcome. Yeah.
Doctor, let's start off. Stevens-Johnson syndrome. How do we replace the offending medication?
Well, with anything, you have to think about, being a medication expert or, physician or anything. Typically, your pharmacist would be available for any counsel or advice. You have to think about what type of medication is it, and you have to think when you're replacing, you have to replace something that's not similar in structure. So one of the most common classes is when you think of as antibiotics, for example, penicillin. So penicillin, you have to think about the molecular structure of the medication. So whatever you replace the medication with, it has to be something that's different, as well as being effective to treat whatever condition that you have. So the main point is, remove the offending agent and replace it with something that's structurally different than, the medication that's causing the Stevens-Johnson syndrome. So finding something that works and that's completely different.
You're actually envisioning the structure of the molecule of the drug and not wanting to inflict upon the body something similar to prevent a similar reaction.
Well, yes, of course. And so, like I said, we have the technology, and with current understanding of drugs and medications, we know, the medications to the exact molecular structure.
How important is the prevention of secondary infection?
Now, once you've experienced Stevens-Johnson syndrome and you've, if it's gone to a more severe continuum, such as toxic epidermal necrolysis, prevention of infection is the utmost concern, just because with T.E.N or toxic epidermal necrolysis, your body system, your skin is being affected, and no longer have that barrier to protect you from the outside world, which is mainly microbes. So that one, when your body's already weak and your immune system is already being challenged, infection prevention is of utmost importance.
They're exposed, they're weak because of this.
Yes, of course. Your body is in a state of chaos and, being with inflammation and things, your body's overreacting, and it's producing, inflammation chemicals that are actually harmful to the body. At the same time, you're losing the protective barrier of your skin. If your Stevens-Johnson symptoms do progress to cause your body to slough off the skin, you're basically just like a burn patient. So
these people, even if they don't have a secondary infection, that's one of the highest priorities because it can kill them.
Well, of course, if you get one of these infections, it's hard for your body to protect and to heal and things like that, because you have other things to worry about, such as organ damage and other systemic failures, because your skin not only prevents you from infection, it prevents you from losing water, hydration, which is a big part of the term is called homeostasis, which means your body at balance. Your body is able to maintain balance of your blood pressure, just in terms of electrolyte imbalance and things like that, just to keep you on an even keel. And when this is disrupted, your body's all in a state of chaos.
Let's focus on that electrolyte imbalance. How important is that?
Well, of course it's important, because electrolyte imbalance is really important for cardiac function, or for your heart system to function properly, with maintaining blood pressure. So blood pressure means blood supply going throughout your body to supply your body with oxygen and nutrients and things like that. So when you have electrolyte imbalance, it can cause a disruption in how your body's blood supply. And in addition, you know, if electrolyte imbalance is bad enough, another route it can take is end organ damage, which means like, you know, your kidney function, you know, is one of the things that come to mind, you know, that can get affected, you know, your liver and other, you know, other body systems.
How important is creating a physical barrier, say with dressings, with respect to this damage?
Oh, of utmost importance. It's kind of the high, you know, the same thing with infection prevention, maintaining hydration / electrolyte imbalance is kind of part of the whole equation. They're all interconnected. They're not separate. So this is something that's happening in tandem. So if you're a patient who experiences Stevens-Johnson's, which progresses to the toxic epidermal necrolysis, all these items that Matt and I have been discussing the last minute or so, they're all happening all at once, that physicians, nurses, doctors, pharmacists have to keep in account that all these must be controlled, because you can't, it's not a stepwise process, because any of these can happen at any one moment that you have to keep in control.
It's all happening at once.
Yeah, and in some patients, it may be in various stages, and it, like I said, it's not a formula. It's just a general thing that you have to think of when you're a patient that comes in. You know, you're being watched, you're being monitored typically in an intensive care unit. If you are, you know, if your skin is sloughing off and you're experiencing all this chaotic inflammatory processes, you know, and you're requiring, you know, antibiotic infusions, steroid infusions, you're requiring electrolyte fluid infusions, you're going to be in a higher level of care in the hospital. So,
as part of one of our other videos in this series on Stevens-Johnson syndrome, Doctor, you and I discussed the medications that were used.
mm-hmm.
And I heard you just mention steroids.
Uh-huh.
Where do steroids come in for Stevens-Johnson syndrome?
Well, Stevens-Johnson, by the definition of the disease process, it's when your body's inflammatory process goes out of control. And so there's a fine balance. You know, first you have to calm down your body system. It's your natural body's ability to fight against, you know, traumatic events that happen to you. So you don't want to completely stop it, you know, so you have to kind of balance the steroid treatment. So you want to calm your body down enough to where it's not harming itself, but at the same time, you want to give appropriate treatment.
The steroids are calming the body?
Yes. So it's kind of tampering down your inflammatory process. But at the same time, you want your body to be alert and aware and healing itself.
Is this inflammatory process what started the Stevens-Johnson syndrome?
Yes, your body meets an offending agent, like such as a drug or an antibiotic, and then it reacts. It recognizes it as a foreign object in your body, and then it triggers I call it a cascade. Think of like your fingers reaching out and your body just sending out chemicals, various chemicals that are actually causing your body just to negatively react, like swelling, some of the things that you think of inflammation, swelling, heat, things like that. And so mainly it's just we're trying to calm your body down enough so they can start the healing process.
The steroids are important because they stop the process that's causing the harm in the first place.
Yes.
Okay. Well, doctor, thank you for explaining these concepts to us. We appreciate it.
You're welcome.
For further information, I direct you to my website. I have detailed information on Stevens-Johnson syndrome, toxic epidermal necrolysis, and its effects on the human body. I'd like to also direct you to our YouTube channel. We have a number of videos on Stevens-Johnson syndrome that can help you. Most importantly, I want to know what your experience has been. Comment below and we'll look at those and we'll try to address any questions that you may have, perhaps even in a future video. I'm Matt Hamilton. I'm here with Dr. K.K. Hamilton, and we thank you for joining us.